post-procedure. Now that we've covered the essentials for your surgery day, let's look at what to expect following your procedure. Pain management. Managing pain effectively is crucial for your recovery. We'll guide you through the medications and techniques that will help keep you comfortable.
It is normal and expected that you will have pain or discomfort after hip replacement surgery. Postoperative pain can last a few days or several weeks, depending upon your individual pain tolerance and activity level. To manage your postoperative pain, it is important to take your pain medication on a regular basis, using ice throughout the day, and keep your legs supported and positioned properly, ideally with your hips slightly elevated when resting. Staying ahead of your pain is key. Take your medication consistently at the intervals specified by the surgeon. If medication is ordered every 4 hours, then take it every 4 hours, especially the first few days after surgery. You do not want to let your pain get out of control. If you wait too long to take pain medication and that pain level shoots up, sometimes it takes several dose cycles before the pain level will come back down. It's common for patients to hesitate in taking their prescribed pain medications, either due to how the medication makes them feel or concerns about addiction. Rest assured, if you're using the medication solely for recovery from a total joint replacement, the risk of addiction is minimal. You won't need the medication for an extended period, and your surgeon will prescribe only the necessary amount. Our goal is to ensure you don't experience unnecessary pain. Some patients may find that they can control their pain throughout the day with Tylenol, which is fine. You may want to reserve the stronger pain medications for before physical therapy and bedtime. These are 2 times where the stronger medication is recommended. If you are admitted, they will not automatically bring you medications unless you ask for them. Work with your nurse to keep your pain under control. Communication is key. You will not be bothering the nurse. They want you to be comfortable. You'll be provided with patient education materials, including a listing of potential side effects. Make sure you review this listing beforehand, and if you experience any of these, please notify your surgeon. Movement and walking helps prevent stiffness, improves circulation, and supports healing, which can reduce pain over time. However, it is important to balance movement with rest. Overdoing it too soon can increase discomfort, so following your physical therapist's guidance is crucial. The more you control your pain, the better off you will be, because you'll feel better, you'll move more, you'll do your exercises, and ultimately, you will recover faster. Special precautions. Your hip precautions will depend on the type of surgery you've had, either a posterior or anterior approach. These precautions are in place to protect your new joint and help it heal properly. Let's walk through what each approach involves and what you'll need to keep in mind during your recovery. If your surgery was completed using the posterior approach, your incision will be located along the back of your hip or upper thigh. To avoid dislocating your new hip, you'll need to follow these key precautions. Don't bend your hip more than 90 degrees. This means avoiding deep chairs, low toilets, or bending forward to tie your shoes. Don't cross your legs, not even at the ankles. Don't let your legs turn inward. Keep your toes pointed forward when sitting or lying down. Sleep on your back with a pillow between your knees to keep your hips aligned. Avoid low or overstuffed chairs and sofas. Choose firm, supportive seating. Don't twist your body when standing, walking, or lying down. Move your whole body as one unit. Avoid bucket seats in cars. These are often too low and can cause your hip to bend too far. Use a reacher or grabber to pick things up from the floor. No bending. Don't sit in a bathtub. Stick to showers or sponge baths until your surgeon says otherwise. If your surgery was completed using the anterior approach, your incision is located along the front of your hip or thigh. This approach has a different set of precautions to protect your hip, which should be adhered to. Don't extend your leg behind you. Be careful when dressing, bathing, or stepping backward. Avoid rotating your surgical leg outward. Keep your toes pointed straight ahead. Don't cross the midline of your body with your operated leg. This means no crossing your legs or turning your leg inward or outward too far. These precautions are temporary but very important. Following them closely will help prevent complications and ensure your new hip heals safely. If you're ever unsure about a movement or activity, don't hesitate to ask your care team. They're here to support you every step of the way.
Potential complications. Awareness of potential complications is important. Next, we'll go through what to watch for.
With any surgery, there is a potential for complication. We want to educate you regarding potential complications so that you can prevent their occurrence and provide you with the information to recognize a concern. Pneumonia. When you are not mobile and are lying down for long amounts of time, you're not breathing as deeply as you would when you're up and moving about. You're not getting oxygen to the bottom of your lungs. It is this air at the bottom which keeps fluid from seeping into your lungs. Without this, your lungs will start to fill up with fluid. Bacteria will start to grow, and suddenly you'll be trying to recover from pneumonia as well as a joint replacement. Our goal is to keep you moving. You're not going to injure your hip by walking on it. You can put as much weight on it as you can tolerate. Change your position often, at least every 2 hours. Any movement you make with your body is going to cause you to breathe a little deeper. And when you're not moving, there are other things that can help keep air in your lungs so that fluid cannot get in. Cough. Take a deep breath and cough. This will help get air to your lungs as well as clear out any food that is accumulated. You should also utilize the incentive spirometer that was provided to you. It's easier to think of this device as a little deep breathing machine. To use this machine, start by putting the hose in your mouth and inhale very slowly as deeply as you can, like you were drinking a very large milkshake, and hold it for as long as you can. Then exhale. You want the bobble that you'll see rise to go up as far as possible. Repeat this process 10 times once every hour while you're awake. Upon completion, follow with a big cough. This again will help with loosening anything that has accumulated in your lungs. Also, make sure that you are continuing with normal mouth care at least twice daily, as we can all inhale bacteria from our environment. Blood clot. The second complication to be on the lookout for is a blood clot, or DVT, deep vein thrombosis. Blood clots are extremely dangerous and very painful. We take blood clots very seriously. Your blood is constantly circulating throughout your body, supplying oxygen. It is important to keep the blood moving so you do not develop a clot. You can do this by staying mobile and moving around. Remember those exercises we talked about earlier? Ankle pumps, quad and gluteal sets? You guessed it, you need to be doing these, especially the ankle pumps, to contract your muscles and force the blood to continue moving. All patients recovering from a total hip replacement are prescribed a blood thinner. It might be something as simple as aspirin. Whatever your surgeon has prescribed, it is critical that you take it exactly as directed. Do not skip doses. These medications help keep your blood thin enough that it's harder for clots to form. If you're admitted to the hospital, you'll likely be fitted with what we call A boots, short for athrombic boots. These are inflatable sleeves that gently squeeze your legs at regular intervals. That squeezing action mimics the natural movement of your muscles and helps push blood up through your legs, just like walking would. Symptoms of a blood clot in your leg include redness, swelling, heat, and extreme pain. It typically starts in the calf area and will move around to the front of the leg. Should you experience this, you should contact your surgeon immediately. He will order a test and have you come in to determine the appropriate course of action. If you have a blood clot in your chest, you can have shortness of breath, chest pain, or both. If you have these symptoms, call 911. Do not take chances unnecessarily. Infection. Another complication to be on the watch for is infection. Infections are caused by bacteria. The number one way to prevent infection and to fight germs is to wash your hands. This is especially important if you are going to be touching your incision. Also, you do not want to use any creams, lotions, powders, or medicine near your incision. Be sure to check and follow your discharge instructions. Most patients are able to shower the day after leaving the hospital. This means shower only. No bathtubs, hot tubs, swimming pools, lakes, oceans, etc. You do not want to submerge in any body of water until your incision is 100% healed. Germs live in water and have the potential to cause an infection. Additionally, you should also be cognizant of dust and dander, as well as anything which may be on your pet's coat. Keeping the incision covered with your clothing is recommended. Redness, swelling, warmth, or pain near your incision is normal. This is your body's reaction to your tissue being insulted. However, this experience should be minimal. If these symptoms worsen and the pain is intense, you may have an infection. Other things to look for include a temperature over 101, continuous bleeding, foul odor around incision, significant clear drainage or any yellow or green drainage or pus. If any of these occur, you should contact your surgeon right away. You may be directed to urgent care. However, it's best to contact your surgeon first. Constipation. Constipation is a very common complication. It is a side effect of pain medication. It is also caused by dehydration, immobility, and low iron. With that said, the likelihood of becoming constipated is very high for total joint patients. We recommend that patients take both a laxative and a stool softener every day until you're completely off pain medication. The reason we ask you to take both is that they do two different things. The laxative is going to get your gut moving, and the stool softener is going to make the stool softer and easier to pass. If you follow this regime, you should not have a lot of difficulty with constipation. Swelling. Swelling causes pain. This pain can be considerable and lasts for 2 to 3 months after surgery. The way to get rid of swelling is through ice and elevation. It's important to note that these actions won't help if they're not done correctly. You will be provided with a bag of 4 gel packs after your surgery. These will be yours to take home with you when you leave. 2 of these should be used at a time on your leg, with the other 2 in the freezer. Apply ice directly to the area where you feel the most discomfort. Use it for 30 minutes on, then take it off for 30 minutes. If you're rotating between different areas, like the front and side of your hip, that's fine. Just make sure each spot gets its full 30 minutes on and off. This should be done several times throughout the day. If you're only icing once in the morning and once at night, you likely won't see much benefit. Now let's talk about elevation. You must elevate your leg such that it is higher than your heart. Sitting in a recliner won't do it. You're not going to get the leg high enough. This is important so that gravity can do its job and pull the fluid out of your leg into your abdomen, where it can be reabsorbed quicker. When you do this, the swelling will go down and subsequently your pain level will go down as well. When your pain level goes down, you'll feel better, move and exercise more, and recover faster. Important note, never place a pillow directly under the bend of your knee. While this advice is often given for knee replacements, it's still relevant here. Putting pressure behind the knee can restrict blood flow to the lower leg, increasing the risk of nerve damage or blood clots. If you want to prop your leg, the correct way is to have 1 pillow going lengthwise from your buttock under your thigh, then 2 to 3 pillows horizontal under your ankle and calf. The pillows will help to support your leg and keep it from hyperextending, and there'll be nothing under the knee pushing into it. This also allows for the heel to hang over to facilitate the completion of ankle pumps, which again you should be doing every hour.
Orthopedic equipment. Using orthopedic equipment correctly can aid in your recovery. Let's go through what equipment you'll need.
Let's talk about some of the equipment you'll need or want after your hip replacement surgery. The first thing to know is that mobility aids are essential in the early stages of recovery. Most patients will start with either a walker or crutches, depending on your surgeon's recommendation and your comfort level. If you're using a walker, we recommend the type with 2 wheels in the front and no wheels in the back. This provides stability while allowing you to gently move the walker forward as you walk. 4-wheeled walkers move too freely and can be unsafe right after surgery. If your surgeon recommends crutches, make sure they're properly fitted. When standing upright, the top of the crutch should be about 1 to 2 inches below your armpit, and the hand grip should be even with your hips. Your elbows should bend slightly when you hold the grips. Crutches can offer more mobility than a walker, but require good balance and upper body strength. You do not need to bring your walker or crutches into the hospital. Just have them in your car for when you're discharged. They'll help you get safely into your home. Once you're home, you might want to attach a small bag or pouch to your walker, or carry a lightweight crossbody bag to help transport small items, since you'll need both hands for walking support. As you recover, you may transition to a cane. Just like crutches, canes need to be properly fitted. To determine the appropriate cane size, you should stand upright with your arms hanging to your side. Place the rubber tip, this is a must-have, end firmly to the ground and lean the cane against your leg and arm. The cane top should stop at wrist level. If it only goes to your hand, it is too short. If it goes to the middle of your forearm, it is too long. It is imperative that whatever cane you choose be the right size and have a rubber tip at the bottom. Be careful. You're not going to injure your joint by walking on it, but a fall could injure the new joint. Insurance doesn't cover the following optional items, but they can be extremely beneficial for you to have: a raised toilet seat. These can be very helpful, especially if your toilet sits on the low side. If you choose to purchase a seat, we recommend that you choose the one with arms attached. These are important to allow you to use your arms to guide you and help you with balance. They will allow you to push down when standing in order to stabilize as well. Safety bars can be particularly beneficial in the bathroom to help prevent falls. These can help with maneuvering in and out of the shower and give you something to help maintain balance. Again, stay away from bars held up by suction cups. Lastly is the shower bench or chair. You can position these such that they are next to the shower, allowing you to sit down and then carefully swing your legs over the bathtub side or shower lip while seated. You can use these for getting in and out of the shower safely. Once you can lift your leg over on your own, it will also allow you to be more independent and shower without assistance.
Urgent care. Unexpected issues can arise. Let's discuss what to do if urgent medical attention becomes necessary.
Before heading to an urgent care, please reach out to the Total Joint Coordinator at St. Elizabeth at 859-301-0405 during business hours, or contact your surgeon's office for guidance. If your concern isn't truly urgent, we want to avoid exposing you to unnecessary germs in those settings. If it's determined that you do need to be seen, both St. Elizabeth Healthcare and your surgeon's office have urgent care locations throughout northern Kentucky. However, if you are experiencing bleeding, chest pain, shortness of breath, or swelling in your mouth or throat, do not wait. Go directly to the emergency room or call 911.
Implant cards. Following surgery, you'll also receive an implant card. Let's go through what this is and when it might be beneficial.
A week or so after you are discharged, we will send you an implant card, signifying that you have metal in your leg. It's important to note that these are not accepted at the airport. They can be beneficial at other places like banks, museums, sporting venues, or any place that you may have to go through a metal detector. These laminated cards will have your name on them, the date and location of your implant, and the name of your surgeon. You can stick it in your wallet and you'll have it should you ever need it.
Patient-reported outcomes. St. Elizabeth values your feedback. Here's how you can share your recovery journey and experience with us.
As part of your recovery journey, you'll be asked to complete several online assessments at different points in time, typically before surgery, at 3 months, and again at 1 year after your hip replacement. These surveys are standardized tools used across the country to help healthcare providers compare outcomes and track patient progress in a consistent way. While some of the questions may not seem directly relevant to your specific situation, they are part of a national framework that allows us to evaluate your recovery and measure improvements in your overall quality of life. St. Elizabeth Healthcare and your surgeon use this information to monitor your progress and ensure we're delivering the highest quality care possible. Your participation is incredibly valuable, not just for your own care, but for helping us improve outcomes for all hip replacement patients. Each survey takes about 15 minutes to complete. You'll receive an email a few days before your assessment with all the information you need to participate. If you don't have an email, we'll reach out to you by phone instead. You'll notice that the same questions are asked at each interval. This is intentional. It allows us to track your progress over time and see how your function and quality of life improve. Note, these surveys are required by the federal government for Medicare patients, but we encourage all patients to participate regardless of insurance status.
If you have any questions regarding this information or your upcoming procedure, please reach out to the Total Joint Coordinator at 859-301-0405 or send an email with your questions to askortho@stelizabeth.com. Thank you again for choosing St. Elizabeth Healthcare. We are proud and privileged to provide services to you and want you to have the best patient experience possible.